guys, I'm Melanie.
I'm Lillian.
I'm Melissa, and we are
Real
Talk for Real Minds. And today we'll be sharing this episode with Aldea.
I'm Jen Padilla. I am Program Director for Aldea for a substance use program and mental health services.
And I'm Carlos Leon, Supervisor at Aldea.
So in this episode, we're going to be talking about something serious. We're going to be talking about addiction and substance abuse. And this is a really serious topic. So we want this to be a very open conversation and honest without any judgment. So do you guys want to introduce yourselves and what you guys do?
My name is Jen, like I mentioned, and I am the Program Director for Aldea, specifically their substance use program and mental health services.
Hi, I'm Carlos Leon. I am a supervisor also at Aldea, and I work in the SUDS program, prevention, and our peers program.
So what made you guys want to work in this field?
For me, that's a good question. I always take it back to high school. When I was in high school, I went to Napa High here in Napa. And I always kind of had this calling to help others. I didn't know exactly what route I wanted to take. I just knew I wanted to, one, give back to my community and just help, right? I remember specifically when it's called the Wolf Center where I work, the building right now that Aldea has. When it opened, it was called the Wolf Center. It was in part of Aldea. And I remember when it went up and I was in high school and I said, one day I'm going to work there because I knew it was helping teens. So I always knew since high school that's what I wanted to do.
I personally know what it feels like to feel overwhelmed, to feel lost, like not have an answer, not know what you're going to do, how you're going to do it, not even understand why you're doing the things you're doing. It's a lonely, desperate feeling. So to be able to come out of that, to fight through that and understand what's happening along the way, and to know the journey and like, how do you not share that? I do it because I owe.
Oh, thank you for sharing that. So when you hear addiction, what do you think people get wrong?
What do people get wrong about addiction? I think it's easy to misunderstand what addiction is. I mean, the definition of addiction is just it's anything that we do in spite of having a negative consequence. So the inability to understand how we're working against ourselves, like we're doing something that is keeping me from reaching my goals, from maximizing my potential, from developing healthy relationships, or even continuing relationships, familial, social. I think that we misunderstand all of the negative consequences that we have, so we misdiagnose ourselves.
Or it's having that label, right? I think often when we work with teens, and that's specifically what our program works with, they're like, no, I don't have an addiction. I'm not an addict. But what Carlos just described is exactly how we do give a diagnosis in our program. Like we talk about that. We kind of step back and say, okay, what issues has using drugs created in your life? The ones that he just explained.
What resources do you guys provide for that? Like, let's say I'm using nicotine. What would you guys do for me? I guess in a way.
For nicotine specifically, we have our prevention groups at the middle schools and high schools that we do education programs or groups. So if teens are interested in learning more about substances and what drugs do to their body, their mental health, or even if they have somebody in their life that is going through substance use and they want to learn, how do I support my friend, a family member? We have specific prevention programs at all of our middle schools and high schools. You could just, reach out to one of your counselors, and that's how you could get referred to one of our programs. Or you yourself could call us at Aldea. Yeah. Carlos, do you want to add anything?
Yeah, for sure. I think that one of the key things that we do, especially in probation, which is one of the lowest levels, if not the lowest level of kind of services that we provide, is begin to develop self-awareness. It's kind of an introduction to ourselves. You know what I mean? Begin explaining and understanding that you, in your case, you said nicotine, that the substance that you're using is not a mistake. That you've been on this trajectory. You've been working on making different decisions along the way, and just kind of delineating that along the way, how, when, where, what those thoughts have looked like, what they sounded like, what those emotions were like, what those feelings were like. So in beginning to understand that we are on a trajectory. And right now I'm experimenting with nicotine. If I continue that trajectory, what does that look like? What's next? Where am I going to go? What's going to happen?
Does the process take longer depending on like what drug or addiction, like compared to like nicotine and the process of like doing like actual drugs?
Yeah.
I think it goes down to like what is that person dealing with in their current life, right? Somebody could use nicotine for a couple months, but maybe they're really overwhelmed with what is happening in their life. They're having issues. Somehow they go to a party and they're offered some marijuana or something else, a pill. And they're so desperate in the situation that they are in that it's just easier for them to accept it, right? Use it. So it really, really depends on how that individual, what type of coping skills do they have access to? What friends are they with during that day or party or game, whatever it might be, right? Who's supporting them? And that's exactly what our substance use program and prevention helps with, more so the treatment piece of it, right? That's what we equip the youth who come to our services. It's not about like, oh, you're doing things wrong and you're going to get into trouble. It's more of what is the situation that you're currently going through.
And how do we get you out of it? Yeah.
Something that I feel like isn't as common or seen as an addiction is with opioids, especially like in the athlete community. Can you guys touch on that a little bit?
I think so even to add to your question, like, is it different? Is recovery different depending on the substances? I think a lot of it. So one of the things we do before anyone is diagnosed, there is this very, very detailed assessment, right? And part of the information that we gather there is amounts, frequency, severity. So with regard to substances, it truly depends on where you are in your substance use. And then we start to, so treatment literally is identify the situation, identify the problem, work with your participant, your client, and develop a strategy, like something realistic, something that is appropriate, and then start to set smaller goals. Little by little, we start to develop, we start to gain momentum. But truly, it depends on where you are with your substance use, severity, amount, frequency, all of those things.
And we really work with the youth, right? Some of the youth who come to our services are on probation. They're required to come. But we often also get those clients who want to be there, who want to make some changes, reach out. Or they're, I'm using too much. I'm using every day. I want to scale down. I want to use less. So we really, again, we equip them with those interventions and skills that they need to use less or be abstinence.
Speaking of young people, how do you think teens usually start?
The mental health lens, like seeing what is that person going through. How could we expose youth to good role models and show an alternative life of what a life could be without substances? I think with the pressures that youth currently have, social media, instant gratification, those dopamines like coming into your brain, you're scrolling on TikTok, Instagram, that's immediate things, informations that you're all getting, right? That we're all getting. So I think it's important, and I feel we often don't talk about what is something fun that youth could continue to engage that doesn't include that type of lifestyle, right?
I love that point, because I think like change is such a misconception. Like once you learn how to play baseball, you'll never forget how to play baseball.
Do you all think addiction looks like? And maybe we
Okay.
could start from there. What
That's
do
a
you
good question.
envision, or what have you seen addiction look like in
I think
Yeah.
your peers?
Yeah, what she said.
I think I think that if you're using a substance to cope with what you're feeling, that's addiction.
Okay.
I think if you're using it every day to like, I'm having a rough day, boom, you're taking it. I think that's addiction.
I think for me, when I envision it, it's kind of like they're getting like anxiety whenever they don't have like the access to
Okay.
that, or kind of like stressing out and like kind of like, you know, panicking if they don't have that substance or something.
I feel like for me, like I used to think of like in the movies, you know, they're all like they haven't showered in days and they're like crazy and yelling, but it's actually something so like secretive. You would never know.
You never know if someone's
You would never know. And after they might have, you know, drank or smoked or whatever, they feel peace, like they feel calm, because probably like she said, like they're using it to cope.
You all hit on one of the requirements that for us to give a diagnosis of someone having a substance use disorder. So them not taking care of themselves, somebody else pointing out that they have a problem, using every day. You all kind of hit on one of the 11 symptoms that, you know, they need to have at least 2 to 3 or more for them to have a substance use disorder. So yeah, you're right. But it really does depend on the substance that they're using. It could be different for everyone.
And I think it takes on, you develop this like new normal, right? On addiction, where you're feeling all of those kind of symptoms that you guys just described. You're feeling all of that unless you're on the substance. So addiction eventually gets you to a point where your normal, like your baseline, is when you're under the influence. So I mean, it gets that evolved. It gets that kind of it gets that serious.
So that's when somebody starts to chase the high, we say, like you want to continue to feel normal at base, but is it when you're high, right? So that's when the addiction starts developing, because you need to feel normal, or you need to go get high to feel
To
better.
function.
I'm glad that you said that, because that just made me sympathize so much more, because it means that someone doesn't feel safe
without.
or okay unless they're on that. And now it's like she said, it's not like, oh, like you were doing that, like you're so bad, but it's like they don't feel okay.
Yeah, they need different coping skills, support, and it's really, some people get, so we've had parents before or loved ones that are like, well, can't you just stop doing it? It's not that easy. We really want to support that person, the individual, to understand how the addiction works, understand where they're at in their own process, right? And then really start introducing new ways that they could feel better.
I think we're going to be wrapping up our episode. Thank you guys so much for sharing everything about your recovery program and what you guys do in your system for Aldea. It was really nice hearing everything you guys said.
Thank you so much. I appreciate it. I had a lot of fun.
Yeah, thanks for inviting us.
So, guys, how do you feel? We just filmed our last episode.
I'm sad.
It's
Me too.
bittersweet.
Definitely.
It's so bittersweet.
I know.
I'm gonna miss, and we're real talk for real mind.
I know. I feel like we filmed a lot of great episodes
Yeah.
this season.
Our topics were like so great and like thoughtful, and they really like touched on a lot of things I think a lot of people could like relate on. Because I know I was able to relate
Me
on a lot of
too.
things.
Yeah.
And learn a lot of new
Mhm.
things.
Yeah, I think a lot of the people that we had come on to our podcast were really helpful and gave a lot of insight and personal feedback for us that we could really use.
Yeah,
I
I
really
think
like
we
that.
overall did pretty well on production and organizing the episodes. So pat on the back for that, guys.
yeah.
pat on the back.
Yeah, we all got to lead an
Pretty good,
episode
yeah.
too.
My favorite parts were those moments where the guests were speaking and you just had this genuine conversation when I would ask questions and be like, wait, I want to know more. I want to know either for myself or for someone else. But it just felt so in the moment that I would forget the cameras were recording.
Yeah.
I agree. I feel like that's one of my favorite moments too, because like especially when they're talking about such like a detailed or like specific experience, and you're like, wait, I can really connect to that one. You know, I also really enjoyed that. Also, I liked the episode before this with I really like that episode.
Yeah, I like the keynote speaker.
The keynote speaker for first gen.
Like Hernandez.
Yeah.
She was really great, and I really connected with her, and I really liked just sharing memorable moments with her. I felt like we all connected really well.
Yeah, I agree. I think my favorite moment was just having our guest speakers, but then also like having the opportunity for them to give us like advice on certain things. Like a lot of the things that we talked about with like coping mechanisms, like I could like closely relate to it, and a lot of it like actually really helped like how I navigate through life, because I keep that in mind now, and it's like it's actually helping, and it's so great that we're able to like talk to professionals that know about it. So it's like it's a really great experience. It was really nice.
Yeah, and like we get to like flex that we're on the podcast.
You know, literally we're high schoolers on the podcast.
Like, just
I know.
like,
We have our own podcast.
Yeah.
One thing I didn't expect was like the fact that there was like a lot of emotions. I feel like
Oh
one
my
thing
God.
I didn't expect
Yes.
either. Like, I think like I also started to cry a little bit when I like see like even our guest speaker cry, or like one of like, you know.
Yeah, there's a lot of emotions, and I don't know. It just felt really real.
Mm-hmm.
You know, it wasn't something
Nothing
that
like-
I like sage or anything. It felt real, and it felt like I was truly like that I belonged there.
Like I thought, because like these are directors, like managers of these like official professional places, and I was like, well, maybe we won't be able to connect, but like they're so willing to actually help you and like relate to you, get to your level, that it's like not scary when you talk to them.
Yeah.
Expect
And a lot of them also like would talk to us after too, like if we need any like further resources.
Yeah, you got a lot of opportunities afterwards. Like with our keynote speaker, she gave us like a link of where you can get therapy, and just overall just like gave us a lot of resources to go to.
Some advice to our viewers, I'd say just like whatever you're going through, like mentally or whatever is going on, just to keep pushing. And life is like totally worth it, and things definitely get better.
I agree with that. And if you're someone who's joining the podcast, one piece of advice is like, don't be afraid to be open and friendly. Like, I feel like the reason we were able to bond so much is because we were like honest and open with each other. And yeah, but like she said, like there's so much more to life that your current circumstances don't determine everything, right?
I also would say like don't limit yourself to like the topics of conversations you can have, because this is like your one chance to speak on a specific topic that you want to talk about so freely and openly, and that will have like a spotlight on it, you know, like a lot of attention. So I feel like it was really nice to have that opportunity, just like sharing like your experiences and like what you think you should, you know.
I think the last piece of advice would be to be yourself. Take advantage of the podcast, and you know, really let the viewers see who you are, and you know, express what you think and what your values and morals are. It's like take advantage of that, because it goes by like this.
Like this.
Okay. I'm Sayuli signing off.
I'm Lillian signing off.
I'm Alyssa signing off.
And this is Melanie signing off.
And
we
are Real Talk for Real Minds. Thank you guys so much for watching. Oh, that's so sad.